the West Midlands.
Good morning, it's 11:14. So, have you had, or have you thought of having private healthcare? The number of people paying for treatment has risen during the COVID pandemic. Now, of course, we know that there's been a huge increase in NHS waiting times. We've discussed that over the last few weeks, haven't we? Well, it seems nearly 400,000 people are waiting more than a year for a non-urgent surgery. Now, that compares to just 1,600 before this pandemic began. So how desperate are you for treatments? And have you sort of like sat there and thought, OK, right, I really need this doing. I can't wait. I'm so uncomfortable, or I'm so concerned about my welfare that I am prepared to go private. And it's other people today that have been waiting a long time for surgery. Do get in touch, though, this morning, 08081 009956. And let's speak to David Hare, who's the boss of the Independent Healthcare Providers Network. Now, this is the trade association that represents independent healthcare providers. Morning, David.
Morning, Caroline.
So have you seen a surge in people going private?
So we've certainly seen over recent months, and I don't think we should be surprised about this, an increase in the number of people that say they are sort of considering looking at their private options. So we think from polling around about a quarter of the public are saying that they're more likely to consider that. And I think for the reasons that you described very well actually there in your introduction, you know, the sheer pressures the NHS has been under, that increase from just over 1,000 people waiting over a year for treatment to over 400,000 now. 1.1 million people are actually waiting longer than 6 months for treatment, that people are looking at what their options are. And of course, you know, if you are living in pain, if you are, immobile or whatever it may be, then actually, you know, you want to get treated quickly. And therefore, I don't think we should see this as a huge surprise.
And of course, there are going to be people that want scans and so on and so forth for peace of mind, because they could have something wrong with them and they want to know just what that is. And they feel that they can't afford to wait. You know, time could be against them in some of these cases.
I think that's absolutely right. I think, you know, the NHS has made clear people should be coming forward if they have got concerns. You know, the NHS has done a heroic job over the course of the last 12 months. And indeed, the independent healthcare sector has been supporting them during that period as well for the NHS, over 3.2 million NHS operations in private hospitals since March last year. But, you know, clearly people, you know, want to make sure that their, you know, any concerns they have, early cancer diagnosis or whatever, is done quickly, and therefore sort of getting in early and making sure you're seen is, I think, you know, seen by everybody as clearly really important, and we would strongly encourage people to look to do that.
But I guess it doesn't even have to be anything, you know, life-threatening. Even minor ailments, if you're living with them day to day, they can really impact your life, can't they? And the comfort of your life. You know, we had somebody on last week that had got, I think it was a turned-in eyelid, and actually, you know, going through life day to day with this discomfort. Now, to somebody that is seriously ill, that may seem minor, but if you're going through it, and it's your discomfort, and if you can get it sorted privately and you can afford to, why not?
I think that's absolutely right. I think sometimes we forget when we look at pressures on the health service that actually, you know, a lot of people maybe with more minor conditions, they're not minor for them. You know, actually that has a real impact on their ability to go about their daily life. It may be restricting them in terms of their ability to be able to work and earn an income and so on. And therefore, I think, you know, every patient is important, and the health service in this country, both the NHS and the private sector, you know, has a big job of work to do actually over what is likely to be a number of years in helping to recover the backlog and make sure that people are seen in a reasonable time period. You know, let's not forget we haven't seen really long waiting lists in this country actually for quite some considerable period of time. And being realistic, they are, you know, likely to get worse before they get better, and it will take a period of time to recover them. So, you know, people considering what their options are to pay for private healthcare, whether that be using their insurance policy, and we think about 30% of people with an insurance policy don't use it. So, you know, encourage people to use that where they've got private medical insurance, or to fund their own care directly. You know, it is very logical, makes sense, and is potentially the right option for a lot of people.
It's a curious thing, though, isn't it, having peace of mind? And I've talked to a great deal of people that have had an appointment. They've got something wrong with them, but they've got an appointment to be seen. And the minute that they get that appointment, it gives them peace of mind, because they know that they're going to get seen. And then as they get nearer and nearer to that day, that appointment is cancelled. cancelled, and so they start to feel kind of like really worked up again and really vexed, and it plays on their mind. So I think to know that something is going to be done, even if you've got to wait 3 months for it or a month for it or a few weeks, at least you know that you're on the road to a conclusion.
I think that's absolutely right. We speak to a lot of patients as you would expect. I think, having that initial diagnosis, seeing that individual clinician, having a sense of what the issues are, how serious is it, or how what then needs doing in terms of treatment. Actually, that can bring a lot of peace of mind. Then, of course, you do want the procedure if you need a procedure, and you want that done quickly as well. But getting into the system, sort of feeling like someone's taking that seriously, they've given a view, really, really important. And obviously, the longer that takes, the more concerned people get for their own welfare, quite understandably.
Now, has private healthcare become more affordable? Because I think that we look at this and think, we'd never afford to have any treatment whatsoever because it is so expensive. Has it become more affordable?
So I think, there is competition in the market. In the Midlands alone, there are over 25, independent hospitals that are, treating patients. And of course, that competition helps constrain costs. So I think, for a lot of people, they would be surprised actually by how affordable private healthcare is. I would encourage people to, if they do need treatment, to shop around. I think that's really important. To look at quality as well, quality as well as price. I think, people need to look at that. Look at the Care Quality Commission. What is the rating of the hospital that they're looking at? Clearly, the consultant is important in this as well, and knowing who they'll be treated by is clearly critical. So it's a bit of a blend of price, which I think is competitive, but at the same time as well of quality, because people want to make sure they're getting quality services as well as at the right price.
And what sort of procedures are people inquiring about, David? What are the treatments that are popular for private patients?
Well, I think it's across the board, actually. I think, private healthcare tends to cover the majority of procedures, other than those that are sort of emergency procedures. If you do need to be, blue lighted, ambulanced into a hospital for an A&E treatment, then clearly that will be through the NHS. But for hip and knee procedures, for example, which we know have been under pressure over the course of the pandemic, for cataract procedures, even for cancer care as well, actually we are seeing people come forward, maybe first of all for an outpatient appointment or for a scan to understand what the issues are, but then across a range of specialties. And again, I think I'd encourage people to think quite broadly about how diverse private healthcare is in terms of the types of treatments that it can deliver.
Now, I know that we're going to have a lot of people listening that think now, OK, well, this could be something that I'm looking into. Is there a place that you can go to check that, if you're going for a procedure or if you want, more help, that this place is good, that you can get all the checks done?
Yeah, so I think there's two places I would encourage everybody to have a look at when they're considering, where to get treated. So the first is the Care Quality Commission, which is the care regulator in England, and that rates every healthcare provider, NHS and private, and will give a rating. And 9 out of 10 private hospitals are rated good or outstanding under the Care Quality Commission, but clearly each will differ. And having a look at that and understanding how the care regulator ranks that hospital is important. And in terms of the individual consultant, the Private Healthcare Information Network provides a real wealth of information actually on the outcomes that are delivered by particular clinicians, the amount of activity that they do and so on. And so both of those are really good sources of information to help the consumer understand the kind of treatment and care that they'll get, where they're thinking of going.
David, really good to talk to you. I thank you very much for coming on and thank you for your time this morning.